Hello, this is the daily COVID update from Deccan Herald. I'm Akhil. On the bulletin today, Karnataka reports 216 new cases, the sharpest spike till date. The state releases revised SOPs for interstate travelers and issues a new circular to define what containment zones are. Also in the bulletin, Dr K Sudhakar, the medical education minister in Karnataka, makes a strong pitch for public health care.
We need to spend 8 to 10% of GSDP on health. This is my strong view.
But first, a look at the daily figures. At the time of the recording, India has over 72,000 active cases in the country right now and has recorded 3,857 deaths. The ICMR has tested more than 28 lakh samples for novel coronavirus so far and more than 1 lakh samples in the last 24 hours. Before we look at the figures from Karnataka, here are some key updates from the country. The Indian Council of Medical Research advises the use of hydrochloroquine as a preventive medicine against the novel coronavirus. The advisory states that HCQ can be used not only for high-risk individuals but also for the contacts of asymptomatic COVID-19 positive patients. The ICMR advisory comes close on the heels of two studies in the Lancet and the British Medical Journal showing that the medicine doesn't offer any benefits and in fact increases the rate of death among COVID-19 patients. Civil Aviation Minister Hardeep Singh Puri has said that India will try to restart international flights as early as mid-June if the SARS-CoV-2 virus behaves in a predictable manner. He also added that the government was in talks with the states over quarantining passengers of domestic flights, which begins on Monday. Moving on to the numbers from Karnataka. The state has reported 216 new cases, the biggest single-day spike yet. More than 180 of the cases have travel history to Maharashtra. Other travel histories include Gujarat, Rajasthan, Tamil Nadu, Andhra Pradesh. The highest number of cases today have been reported from Yadgiri district with 72 positive cases. It is closely followed by Raichuru or 40. Mandya, Chikbalapur and Gadag have reported 28, 26 and 15 cases respectively. The rest of the districts have reported cases in single digits. There were 2 deaths reported today. Patient 1270, a 32-year-old Bengaluru resident, passed away because of a cardiac problem. The second death was due to non-COVID reasons. Patient 1783 committed suicide in Dakshina Kannada district at a quarantine center in Kadandale. This is a second death due to suicide pertaining to a COVID patient in the state. With this, the state has reported 1,959 cases in total, out of which 1,307 are active cases. 608 patients have recovered while 42 have died. The state has tested more than 9,670 samples in the last 24 hours. Moving on to a few updates from Karnataka, a new standard operating procedure has been released by the Karnataka government for interstate passengers. According to the new SOP, passengers will be sent to institutional quarantine for 7 days if they arrive from Maharashtra, Gujarat, Tamil Nadu, Delhi, Rajasthan, and Madhya Pradesh. This will be followed by 7 days of home quarantine. Those returnees will be tested between the 5th day to the 7th day. Registering on Seva Sindhu is mandatory for all interstate travelers. Meanwhile, the state government has also revised the definitions of containment zones and the standard operating procedures in these zones. The new order dated May 21st nullifies the previous 2 containment orders issued by the state. The new order specifies that a containment zone continues to be a containment zone if the location has 10 or less than 10 primary and secondary contacts of positive cases. Containment zones will be denotified if they do not have any cases or contacts during a period of 28 days. For more information on the revised SOP, please log on to our website. For almost 2 months now, several government hospitals have been turned into COVID care facilities. Many hospitals which treated the poor or those patients with compromised immunity will now have to find a way back to regular operations. To find out how, my colleague spoke to Dr. K Sudhakar, the medical education minister in Karnataka.
Dr. Sudhakar, thank you for joining us. Most of the COVID-19 exclusive hospitals come under your department, which is the medical education department, with an exception of a few district hospitals that come under the health department. What is the exit plan for these hospitals to start treating non-COVID patients?
There are about 17 district hospitals. Similarly, all 12 super specialty hospitals also come under me. These have been converted at the moment as a special COVID dedicated hospitals. So treating only COVID patients.
Right.
As you rightly said, there should be an exit plan.
Yeah.
But at the moment, I don't know in which state we are, in which stage we are. In my opinion, we are still started now. So we need to see in the months of June and July where this is going. But at the same time, we need to carefully understand the behavior of the virus.
Right.
This virus is behaving differently in different regions, in different ethnicity.
Right.
So we need to take everything we are studying. The ICMR is in a regular, constant touch with us. At appropriate time, definitely we have everything as a plan for the exit.
Okay.
But we will take it in a very staggered approach.
Right.
But nevertheless, we understand the requirement, the urgency to treat the non-COVID patients at the same time. We have an engagement, we have an association with the private, the corporate hospitals, and they will be taking the load of what we were taking for the non-COVID from the tertiary existing hospitals.
Right.
So we have made all those arrangements.
How will the government tertiary care hospital look like going forward for immunocompromised patients?
See, we will be having an issue with the immunocompromised patients even in present and the future.
Right.
Because if somebody immunocompromised person is infected with corona, he will really debilitate, he will succumb to this virus very quickly than any other person when he is contaminated.
Right.
Compromised patients will have an issue with corona going forward also. We have been following the isolation wards for them. We need to continue this. I think we need to isolate the corona patients from immunocompromised patients even in future.
Right. So the state is spending about 208 crore to equip every bed in the state with a centralized oxygen facility. This wasn't common before the COVID-19 pandemic. But what are the other changes that will happen, sir, in hospitals because of this pandemic?
See, we are learning so many things. The pandemic is teaching us many things. Every infection, every new virus, every new microorganism which is bothering the human race, we want to equip our healthcare.
Yeah.
So today we have realized healthcare is the most important thing in our lives. So I think every government, including ours, we should wake up, we should strengthen our health sector. We need to spend 8 to 10% of GSDP on health. This is my strong view. On record, I would like to say.
Lastly, sir, public health experts say that hospitals are undergoing changes in the curative area because of the COVID-19 pandemic. But what about the preventive area? What preventive measures like early screening will be taken by hospitals under your department for patients who come?
See, we all know prevention is better than cure, not just for corona, for any other virus or any other infection.
Yeah.
So the community medicine department as whole should be strengthened. Right from village till the urban centers, there should be a strategy. In fact, I am suggesting the government to have two different strategies to handle at the rural level and as well as at urban level.
Okay.
We should have a task force committee at every gram panchayat under a committee. Even if you give them a mandate, the magisterial power, there is nothing wrong. Similarly, when you come to urban, we should treat ward as the structural functional responsible unit, under which again there should be a task force committee. Finally, it can be addressed and supervised by those district committees headed by the district magistrate.
Right.
Similarly, here a DC can
Right.
take care, or a commissioner can supervise the whole thing. So there should be a definite way to handle this pandemic or these kind of pandemics in the future to come. We should be geared up.
Yeah.
That's all from us today. For the latest updates, log on to deccanherald.com. Stay safe, and we'll see you on Monday.